Subscribe to my channel for more information.
They call it the silent killer, and for a very good reason. We're talking about a condition that rarely shows any symptoms until it's already done serious, sometimes irreversible damage to your body. Today, we're diving into high blood pressure, or hypertension, and why understanding it is absolutely vital. According to a huge study in The Lancet, that's how many adults worldwide are living with hypertension. It's one of the most common chronic conditions on the planet. But the most shocking part isn't even the number itself.
You heard that right. A staggering 46% of people with high blood pressure are completely unaware they have it. They feel fine, they go about their daily lives, all while their blood pressure is slowly waging a war on their arteries.
And that brings us to the central question of this entire explainer. What exactly is happening inside your heart, your brain, and your other organs when your blood pressure is chronically high? Let's find out together.
The reason it gets that name is simple. You don't feel it. It doesn't send you obvious warning signs like a broken bone or a fever. It just works in the background for years, quietly damaging your body's most critical systems. To understand the damage, we first have to understand the numbers. You know, when you get your blood pressure checked, you see two numbers, something like 120/80. But what do they actually mean?
At its most basic, it's a measurement of force. It's the pressure of your blood pushing against the walls of your arteries as your heart pumps it to every single cell in your body.
Okay, so that top number, the bigger one, is the systolic pressure. That measures the peak pressure when your heart contracts and pushes blood out. The bottom number, the diastolic, measures the pressure when your heart is at rest between beats. Both of them are crucial.
This chart, based on guidelines from organizations like the European Society of Hypertension, really lays it all out. Normal is considered anything under 120/80, but once you hit 130/80, you're officially in what's called stage 1 hypertension, and anything over 180/120, well, that's a crisis that needs immediate medical attention.
To really wrap your head around what's going on, let's use a simple analogy. Just imagine your arteries are a garden hose. With normal pressure, the hose is flexible and the blood flows through it easily. But with high pressure, that hose is constantly taut and stretched tight. Over years, this chronic tension causes the walls of the arteries to thicken and get stiff. It creates tiny microtears that attract cholesterol, which speeds up the process of atherosclerosis, or hardening of the arteries.
And that brings us to the consequences. This constant, relentless pressure doesn't just damage the hose. It overloads the entire system, targeting specific, vital organs.
And here are the big three: your heart, your brain, and your kidneys. They take the absolute brunt of the damage from uncontrolled hypertension. Let's break down each one.
Your heart is a muscle, and when it's forced to pump blood against much higher resistance, it has to work harder. The main pumping chamber, the left ventricle, begins to thicken in a process called hypertrophy.
But here's the thing. A thicker heart is a stiffer heart. It can't relax properly between beats to fill up with blood. This is called diastolic dysfunction, and it's one of the main roads that leads directly to heart failure.
Now for the brain. According to top medical sources, hypertension is the single biggest modifiable risk factor for stroke. Not smoking, not high cholesterol, high blood pressure.
It damages the brain in multiple ways. The sheer force can rupture a delicate vessel, causing a bleed, or it can accelerate that plaque buildup, leading to clots and blockages. And even without a major stroke, it slowly damages the brain's wiring, contributing to memory loss and cognitive decline over time.
Your kidneys are packed with millions of tiny, delicate blood vessels that act as filters. Chronic high pressure basically grinds these delicate filters down, day after day, systematically destroying them.
Over time, this damage reduces the kidney's ability to filter waste from your blood. In fact, uncontrolled hypertension is one of the leading causes of chronic kidney disease and the need for dialysis.
So, what causes something so incredibly common? Well, it's a mix of factors. Some we can't control, but many that we absolutely can. Let's take a look.
Genetics definitely play a part, sure, but lifestyle factors are just huge. A diet high in salt, a lack of physical activity, chronic stress, and drinking too much alcohol, these are all direct contributors to rising blood pressure.
Let's just focus on salt for a second. Most people are eating double, sometimes nearly triple the recommended daily amount. All that extra sodium makes your body hold on to water, which increases the volume of blood in your system and, you guessed it, raises the pressure.
All right, now for the most important part. Knowing the danger is one thing, but knowing how to fight it is everything. And the good news is that lifestyle change is the cornerstone of treatment for anyone with high blood pressure.
Here are 4 evidence-based steps you can start today. 1. Cut back on the salt. 2. Get moving. Regular aerobic exercise can lower your systolic pressure as much as some medications. 3. Try the DASH diet. It stands for Dietary Approaches to Stop Hypertension. It's rich in fruits, vegetables, and whole grains, and it's scientifically proven to lower blood pressure. And finally, the most critical step of all, know your numbers. Get your blood pressure checked regularly.
High blood pressure is silent, but the damage it causes is deafening. It's a leading cause of heart attack, stroke, and kidney failure. The first step to taking control is a simple measurement that takes 2 minutes. Don't wait for symptoms. The time to act is now. Talk to your doctor and get your numbers checked. It could literally save your life.
Subscribe to my channel for more information.